The use of technology to train future medical professionals continues to advance. Baptist College of Health Sciences is now using a new 3D teaching tool for radiation therapy students. Virtual environmental radiotherapy training creates a way to give students hands-on training before they use their skills on real patients. Rod Starns explains the technology in today's cover story.
Radiation therapists use beams of radiation to shrink and kill cancer tumors deep inside the body. They have to aim those beams carefully so they don't affect healthy tissue, which is a challenge, not being able to directly see the beams of radiation or the tumor or healthy tissue. A teaching tool called VERT, Virtual Environmental Radiotherapy Training, is changing that. In use at the Baptist College of Health Sciences, VERT gives students a 3D look at virtual radiation therapy, showing them how to place the body, where the internal organs are, even the exact location of the beams of radiation.
Well, this gives them some practice before they enter clinical training. They can practice here in the classroom. They can actually see what the critical structures are underneath the skin. They can get familiar with the hand pendant and the machinery, so when they go out to clinic, they can actually focus on quality patient care.
Different types of treatment programs are loaded into the computer, and students then go through the same process they would in a real clinic. The control device, or hand pendant, is the same as they'll use in clinic. Even the sound when the table moves is the same. Students like the idea of getting used to the mechanical aspects of the process before seeing real patients.
Being able to practice here on the movements of the tables and seeing why we're making the shifts that we're making made me better able to know this is what I'm going to do with this patient so I can focus on the patient as a person.
It gives us a great advantage because it increases our comfort level. So anytime that you have experience with something, you're going to be a lot more comfortable with it. So we get to come in here, we can practice, and we can mess up in here. And we can learn from our mistakes so that when we go into clinic, we've perfected our skills.
Students using VERT to see exactly where radiation should and should not go is an advantage for teachers. MRI scans or other images can be loaded into VERT, showing very specific details in exact positions, instead of making teachers depend on a combination of other methods to determine the best way to direct radiation.
You know, we always used our imagination, we used drawings, we used CT scans, things like that, and put it together in our own minds. So what this does is it puts everything together and displays it for the student so they can see it all together as one piece.
VERT gives students the chance to go through a virtual radiation session before they experience the real thing. They can get used to the sights and sounds of the actual therapy. The company that created the device also has another program run on a laptop that gives patients a similar opportunity.
We also purchased a laptop for all the cancer centers within the Baptist system called Pearl. And what the Pearl does is it educates the patient and their family, and it takes away that fear factor of what's going to happen to them when they get radiation therapy treatment.
VERT and Pearl were paid for with a grant from the Baptist Memorial Healthcare Foundation. Because of the detail of the different information that can be loaded into the VERT display, Lasley says students in other majors and other classes, like cross-sectional anatomy, can use the VERT as a learning tool as well. For Smart Medicine, I'm Rod Starns.